Hello, our viewers in Nigeria, Africa, and around the world. You're welcome to Talk Here with Dr. Laz, your favorite health program on television. We're reaching you from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. Today on the program, we'll be discussing a very important topic, and it is PAIN, pain. Yes, there is nobody living, any living thing that have not experienced pain at one point or the other. And pain management is a very critical aspect of medical practice. So from small pain to acute pain to chronic pain, it could be for a short while, it could be for a long while. So it's critically important, especially for elderly people, many of who usually have lots of health condition that has chronic pain as one of the major features or signs. But today we'll be focusing more on pains during and after surgery. And of course, we can't discuss pain without mentioning the various types of pain, how pain is being managed, whether it's on a short-term or on a long-term basis. And I'll be joined by an expert in this area who is a Senior Registrar in the Department of Anaesthesiology at the Federal Medical Center, Lokoja. He's been our guest on this program before, and he's returning to discuss this topic. So we'll be showing you our guest, and I know you are looking very forward to meeting him. So just follow us on our various social media handles displayed right on your screen, and don't forget to subscribe to YouTube channel if you haven't done so. All our programs from the first episode to the current one are there. You can always watch as many times as you want. Do stay with us for a short break. We'll be right back. Welcome back to Talk Here with Dr. Laz, your favorite health program on television. As like I mentioned before the break, we are discussing PAIN, pain. Pain management, especially during and after surgical operations. And with me here to discuss it was the second guest we had on this program, specifically 25th August last year, Dr. Nnanna Agwu. You're welcome to the program once again.
Thank you for having me.
Yes, the last time you were here was about how COVID-19 had affected residency program in Nigeria. Then you were the president of the Association of Resident Doctors at FMC Lokoja. So good to have you today to talk about your area of specialization.
Thank you, viewers, and thank you, Dr. Laz, for having me once again.
Okay, but before we go into it, how is the residency program now? There was a couple of strike here and there, and are the issues largely taken care of?
Well, the last time I was here, we talked about issues bordering on COVID and how it was affecting residency training. We are happy that right now that the issue concerning COVID is being handled. The numbers are getting down. The deaths are no longer being recorded.
And residency training
program is faring better.
Okay.
As materials are being provided, and doctors are
happier
than they were then.
So let's start from the definition. I want to read this out by the International Association for the Study of Pain, IASP. This was the most updated definition as at 2020. They define pain as unpleasant sensory and emotional experience. I would like you to explain this further. An unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage.
Okay.
Will you explain this in a layman's language, if I must use that?
All right. Thank you for having me on the program once again. Pain, as we know, it is something that most times people cannot describe adequately. You just know that you are not happy, that you're having some pain within your body. This pain could either be generalized or it could be localized to any particular part of your body. It could be as a result of an injury or even an emotional situation that might be causing this pain. And that is why the group, the International Association for the Study of Pain, came up with such a definition, which makes us to understand that pain is not just when a part of the body has been damaged or that there's a disease process going on in the body, but that there is an emotional component to the perception of pain.
Okay.
So pain has the
Physical.
physiological or physical component, then it also has the
emotional
psychological component,
Okay.
which makes it so that when we are talking about management of pain, most times, you know, it has to be a multidisciplinary approach that has
By
to be used.
multidisciplinary means it's not just one professional's job, so it's a kind of team
It has to be a
having
teamwork.
different specialties.
Yes, yes, it has to be a
Okay,
teamwork.
so looking at that, you know, let's now go into the science, the pathway,
Yes.
especially for the benefit of some resident doctors who might be watching, or even medical students. So from the body's neural system, from the brain to the nerves, how does pain occur?
Okay, now what happens is that, let's say for example, you have a pin, okay? You prick yourself, okay? The body sends information from the let's say from the hand now down to the spinal
The
cord,
spinal cord, right.
where this is processed, and then you have the ascending tracts that move from the spinal cord down to the brain, and the brain now interprets it. This happens within seconds. Interprets it and sends down impulses down through the spinal cord back to your hand to withdraw from that pain. This is
right.
just to make it as simple as it is, you know. But this effect are things that happen in a matter of seconds.
Very less than even a second.
These
because
things
it's sharp reflex, something does and
exactly
you withdraw.
Exactly. So that means that is what makes you now to withdraw from that stimulus that is causing the pain.
Okay.
Because impulses are sent from your hand down to the spinal cord, where this thing is interpreted and then sent back to the brain, where the brain now interprets it and sends it back to your hand to withdraw immediately from the pain. This is just to make it as simple as it can be.
Okay, so that perception is interpreted by the brain. Which suggests that if there is a hemisection of the spinal cord, it may actually affect
perception of pain.
That process.
Yes.
Okay, what I mean by hemisection, if there is an injury to the spinal cord, depending on the level, there might be some aspects of your body you may not feel pain, and that happens for those who even have an injury at the back or the spine, and they discover that their legs, they can't feel
pain.
anything, including pain. All right, so there is a table which I think we'll show that on the screen. So there's a table we show on the screen now while Dr. Agwu explains that. We just try as much as possible to kind of let us know the process that this goes through. The treatment methods for pain, but before we even go specifically into the treatment methods, perhaps we talk about the kind of things that can cause. We've talked about the physical, the psychological, right? So physical could be injury, right? Yes. To the tissue, to any of the body tissue.
Disease could be as a result of disease process.
Okay, what are those kind of diseases?
Let's say, for example, you're having pancreatitis, you have severe pain.
Pancreatitis, inflammation of the pancreas.
Let's say you're having appendicitis, inflammation of the appendix.
Okay.
It will give you pains, even if when you're having ulcer pains, because it's caused in the stomach.
So now we are talking about the
abdominal pains. You understand? Right. It will give you pains of varying degree, give you pains of
kidney stones,
any organ of the body that is diseased. The first manifestation that it may come up with is pain. And usually, if you notice that what makes people come to hospital most of the time is pain. People will not just come to the hospital for coming sick, except they start feeling pain. And that is why some people have even described pain as also a vital sign. So which means that pain on its own, not just that it is a sign, it also helps as a protective mechanism to the body. So once you start feeling pain, you need to do something about that pain, so that you are going to be okay.
Okay, so you mentioned some of this. The cancer is also a health condition that can actually present with chronic pain, right?
Yes.
Okay, so and depending on the parts of the body, whether it's the breast, whether it's the cervix, or even the bones. So and it's a major sign of inflammation.
Yes.
Okay. Yes. So every aspect of the body from head to toe can have that pain. So let's go to these treatment methods. It will be systematic following this table that you provided. And thanks for sharing this table for us so that our readers could really appreciate this. So first is remove the cause of pain.
Okay.
So,
When we want to talk about pain during surgery and after surgery and pain management in general, I will first of all want to classify pain into two. We have what we call the acute pain, and then we have chronic pain. Chronic pain is where the cancer,
the ones that last for a very long time.
That's where the cancer pains come.
And arthritis and
that's where the cancer pain falls into. Acute pain are pain of a known cause. Let's say, for example, you have a fracture. That fracture is what is causing pain. You know that it is a fracture on your leg that is causing pain. Or you have a cut, for example, in your hand. You know that it is the hand, the cut that you have, or the damage to the tissue.
Right.
Is what is causing pain. So that is an acute pain.
Okay.
Then when it now becomes chronic is when this pain persists for 3 months and above. You now classify this as being chronic. And most times, chronic pain is not, sometimes it's not well defined, you know, and then it might not be amenable to the treatment regimen of which you use for acute pain. Okay? Now, when you talk about management of pain, for example, it starts from, because we are talking about pain during surgery and after surgery.
Yes.
So before surgery, you have to do what? The management starts before surgery.
Right.
Where you go for what we call a perioperative visit. Okay,
the visit you do a day before operation.
It mustn't be a day before. It could be a week. It could be 2 weeks before surgery. But at least you would have seen the patient before surgery. You would have discussed about the anesthetic options of the patient. You discuss about the pain management options to the patient. And that is why I advocate that patients who go to the hospital should ask questions. Whatever the doctor wants to do for you, you have a right to know what he wants to do for you.
We actually discussed that a couple of weeks ago.
Okay.
Yeah, the rights of the patient.
Rights of the patient.
And also the right of the responsibility of the healthcare provider to explain what you're doing to the patient.
So during this visit, the management of the patient's pain starts before then. And that is where you now start asking questions of like, okay, when did this pain start? Which part of the body is this pain located to? Does it radiate to any other part of the body? What is the intensity of this pain? Can you describe the quality of this pain? You know, some people will tell you that the pain is either burning, it is throbbing, it is constrictive in nature. You know, patients will now describe how the pain is, how they feel the pain. You know, and then you now ask questions that border on the severity.
Okay, so when you've determined on that, so for the surgery, how do you handle that?
Now, all these things, you know, these are things you do when you have come to review. You are asking questions, you are taking history.
And that's the anesthetist?
As the anesthetist.
Okay.
You know, the work of anesthetist is not just to give anesthesia. It also involves management of critically injured patients in the ICU and also pain management. That is part of what we do. So you review your patients, get all this history from the patient, you carry out necessary investigations that will help you on how to manage this patient, and then you counsel the patient adequately. Now, what happens is that based on this, you develop a work plan of how you are going to manage this patient, which means that if let's say, for example, a patient that has a fracture that is causing pain, when he comes, you splint that fracture, which will help to reduce the pain the patient
The splint is that the thing they used to stabilize it, to make sure that movement is the minimal.
You do that, it helps to reduce the pain of the patient. While you now move into the operative period. During the operative period, you have gamut of pain management options, which includes the use of pharmacological, non-pharmacological methods, which will extend even up to the post-operative period, you know.
Right. So we are going to talk about from operation to post-op after the break. So do stay with us. We'll continue this conversation on pain management, especially during and after surgical operations. We'll be right back after this break. Welcome back to Talk Here with Dr. Laz, your favorite health program on television. We are still talking about management of pain, especially during operations and thereafter. And with me is a Senior Registrar in the Department of Anaesthesia at the Federal Medical Center, Lokoja, Kogi State of Nigeria. So good to be back, Dr. Agwu. We have to be pretty fast now. So when you've determined that before the surgery, you've talked to the patient, you've known the threshold and so many other things, done your investigations. So during operation, how do you manage pain?
Okay.
Or
Now,
prevent pain rather, during operations?
surgical operations involve the fact that there's going to be a breach in the tissue of the patient, which means that patient is going to feel some pain. In doing this, the anesthetist has a gamut of
Options.
that he can use, which means that you can either, depending on the type of surgery the patient is coming for, you can either do a general anesthesia for the patient, you can do a regional, or you can do a local anesthesia. Now, this involves the use of...
So let's try to break it down. General anesthesia is the one that puts the patients
To
completely to sleep.
Exactly.
So regional or local is the one the patient will be conscious,
Yes.
but it's just the part of the body you are doing will not feel pain.
Yes. So
Okay.
it's either you give drugs that is going to numb, those drugs are going to numb the area that is going to be operated on.
Okay.
For in the cases of regional and local anesthesia.
Okay. Spinal is which type?
Spinal falls into the class of regional
Regional.
anesthesia. Yes.
Okay. So the one that if they want to take something out from the hand
That one
and
is a
give
local
injections
anesthesia.
so that, okay, that's
So
local
they
anesthesia.
will infiltrate around the around the area they want to operate on.
Yes.
They infiltrate, and then the patient doesn't feel pain.
Okay.
And then the mass
They
or
go
whatever
with
they
the
want
procedure.
to do
All
will
right.
be done. Okay. So you have gamuts of drugs you use, ranging from normal NSAIDs, non-steroidal anti-inflammatory drugs that you can use.
Okay.
You can use paracetamol as well. You can even use opioids as well.
There's a particular side effect of some of the NSAIDs.
Of course.
Of NSAIDs generally.
Of course.
What's that?
Of course. For every drug has side effects.
Yeah.
Okay. So that is why, as a physician anesthetist, you tailor the drugs that you want to use for your patient to the particular conditions they have.
Okay.
Bearing in mind that you have asked, these are the questions you ask. If the patient has any pre-existing medical condition that will contraindicate you from using any of those drugs. For example, patients who have ulcer, NSAIDs are generally avoiding them. Patients who have coagulopathies, or who have bleeding disorders,
Yes.
you want to avoid NSAIDs in them. Patients who also have renal
And
issues,
NSAID is non-steroidal anti-inflammatory
anti-inflammatory
drugs. Okay.
you want to avoid it in them. Patients who have kidney issues or renal issues, as we use in medical
Yes.
jargon, you want to avoid such drugs for them. Okay. So for any drug you are going to give, you need to know if there's any pre-existing medical condition that will contraindicate you
Yes.
from using those drugs.
And that's really important. There is, I think, what about you've talked about the local, the regional, and the various forms of anesthesia. You talked about drugs.
Yes.
We are not going to be mentioning names of all these drugs because they are prone to abuse when you give names of certain drugs in the media. But of course, you mentioned paracetamol, that is usually for
It's
common over the counter.
Yes.
So there are some that are not over the counter that are prescription drugs.
Especially opioids.
The
Opioids are
opioids.
controlled drugs.
Okay.
Are not allowed to be sold over the counter.
Yes. So and those opioid drugs are the ones that are prone to abuse by some folks.
Of course, yes.
All right. So but that's entirely
That's
a
a
different
discussion
on its own.
Yes.
But what about the psychological aspect of pain management?
Okay. And now, the psychological aspect of pain management is mostly starts from the preoperative visit down. When you are talking to the patient, when you are counseling the patient, you are telling them that this is what they might likely experience. This is how you are going to manage it, and then, this extends from that period till the post-operative period. Okay, which means that at some point in time, if the regular drugs that we are using to manage pain is not working, for patients who now develop chronic pain, let's say after surgery, the pain persists. You can now start.
And that happens sometimes. Women who did cesarean section, sometimes some of them used to complain of back pain or something like that. Does that feel into
it depends
what you're trying to explain?
It depends. That's why I said these are things that you do by reviewing the patient. Every person is unique and peculiar on their own. So when you review these patients, you now know exactly what category of pain the patient is having, the severity, and the class of pain the patient is having. And then you now know whether it's a psychological issue, which is where you now bring in the psychologist or the psychiatrist, as the case may be. And then sometimes you also use psychotic medications as well for this to manage this kind of patient, or antidepressants rather. You use antidepressants to manage those kind of pains.
Okay. So he mentioned, Recorder, I mentioned, you might require the services of a mental health physician or a psychologist or a psychiatrist. Why it's important is many times when people hear psychiatrists, they used to think it's for mad people.
No.
You know, people that have other forms of mental illness. So they are involved in pain management because of the emotional component
of pain,
which also fits into the WHO definition of health.
Yes.
State of complete physical, psychological, social well-being. So when it comes to pain, it involves both physical and psychological, which can also affect your social well-being because your interaction with people and your environment.
You see, the issue about
can
pain
actually be affected.
The issue about pain is that your socioeconomic, somebody who is in pain, for example, his level of productivity is reduced.
Right.
Both to himself, both to his family, and both to the society. Because the patient or the individual is in pain, whichever type of pain the person is having, you know, it has a ripple effect that now goes down to affect the socioeconomic situation of such an individual. And that is why we take pride in making sure that we manage pain, that people who come in contact with us, we try as much as possible to make sure that their pain is at the lowest minimum that they can tolerate and that they can manage to be able to have a effective functional life.
Okay, so we have a couple of, like a minute to round up. There is this pain assessment tool. I think we'll put it on the screen. So how is it used?
Okay, now,
very quickly.
Now, the pain assessment tools, they are varied. You know, pain, both even the newborn child feels pain. So these pain assessment tools are things that we use to grade the severity of this pain. So we have the numerical rating scale, you have the verbal rating scale, then you have there's the one for children, one bakers.
You are moving plenty stuff.
Okay, I'm going to bring it down. So what we do normally when we want to assess pain is that you have values from 0 to 10, 0 being the lowest, while 10 being the most severe. So from 0, you have mild, moderate, and severe. So when you look at that, you tell the patient, okay, going by this chart, from between 0 to 10, at what grade can you grade your pain? It might tell you, okay, my pain is at a grade of 5, or using the diagrams or the face, we have a chart kind of that you show the patient. The patient can now pinpoint and say, okay, this is the level, how I'm feeling about this pain. So it's most times a subjective thing.
Okay.
Really.
So at least the patient will be able to show the
severity of the pain.
We know that sometimes patients also try to exaggerate, the actual.
That's why I said it's subjective. But that notwithstanding, we always say that the patient, no matter how much, that if a patient says he's feeling pain, he's feeling pain. We shall not neglect it.
We shall not neglect it.
Yes.
Okay, so that's how much time we allow us to take.
Actually, pain is quite wide. And,
it's very wide.
Very wide. But what we are trying to do is, at least this is an introduction into it, and then at least people will know that aside giving anesthesia, that anesthetists are also there to manage pain,
acute, chronic pain, and other forms.
Yes.
All right. So hopefully you bring some of those your people in pain management. Perhaps they can come and partner with us on the program to speak more about it. All right. Thank you very much. Pain management is a critical component of medical care. And of course, anyone that has had pain, we know that is one of the things that you really want an immediate solution. So we thank you for tuning in and watching us today. And we also thank the production team for always making sure that we bring you this program every week. So we hope to see you again, same station, same time next week. My name is Dr. Laz Eze. Bye for now.